Go. All right, let's do this. Well, good morning. We're here today because the flu activity is spreading in the United States and in the St. Louis area and with record number of cases. We're seeing more cases than we've seen in a decade. Vaccination is the best way to prevent the spread. It can make a real difference. It can reduce the severity of the disease, especially in kids, in older adults, and people with chronic conditions. Influenza A is the dominant strain in St. Louis County. We've had over 1,500 cases reported to the St. Louis County Department of Health. Emergency room visits for flu-like symptoms are surging. Today we're here to remind residents that it's not too late to get your flu shot. The flu shot is the best way to prevent the spread of the flu. It will reduce the severity of the disease. It will reduce complications. You can get your flu shot at any St. Louis County Health Department clinic, like the one we're at here today at the John C. Murphy Health Clinic. I asked Dr. Cunningham to come today and to talk about how flu is impacting our community. But before I do that, I want to remind everyone the best way to prevent the spread of the flu. You wash your hands, stay home if you're sick, and get a vaccine. Dr. Cunningham.
Thank you. Thank you, Dr. Page. Good morning, and thank you all for being here. I appreciate the opportunity to talk about influenza and what we're seeing right now in St. Louis County. Influenza is a seasonal respiratory illness that can range from mild symptoms to really serious and even life-threatening disease. Every year, flu affects thousands of people locally and millions nationwide, and it's something we take very seriously from a public health standpoint. Today, I also want to share updated information that was released to the Department of Public Health. There have been 8 influenza-associated deaths have been reported to the department this season. These deaths occurred between November 25th and January 10th. 5 were men and 3 were women, with ages ranging from 36 to 89 years old. Although 7 of the 8 individuals were age 70 or older, this serves as a reminder of the importance of getting your flu vaccine. It's important to note that these are reported deaths. We do not know the total number of deaths that may have been seen directly or indirectly related to influenza, and those were not reported to the health department. Every individual who died had underlying health conditions or other risk factors, such as smoking or obesity, and that placed them at increased risk for severe disease. And critically, the majority of these individuals had not received this season's flu vaccine. Those who have been vaccinated also have significant underlying health conditions. This information reinforces what we know about influenza. It can be deadly, particularly for people at higher risk, including older adults, young children, people who are pregnant, and individuals with chronic health conditions. However, even healthy adults can become very sick from the flu, miss work or school, and spread illness to others. You can get vaccinated at any one of our 3 public health centers. Walk-in hours are Monday through Friday from 8:30 a.m. to 10:30 a.m. and then 1 p.m. to 3 p.m. No appointment is needed. More broadly, vaccines are often one of the greatest tools in public health successes we have. And I want to take the opportunity right now to talk to our community about the recent changes the CDC announced regarding the childhood vaccine schedule. As a physician and mother, these recommendations are not rooted in science. Ask any parent who has sat with their baby in the emergency department with RSV or even with influenza. It's scary and it's an unnecessary risk. The underlying science behind the safety of these vaccines have not changed. They have been rigorously tested and have been affirmed through decades of scientific work and real-world use. When fewer people are protected through vaccines, it's more likely we will see outbreaks of infectious diseases that can be preventable, such as measles. If you have questions about the vaccines, please speak to your pediatrician. And if you don't have one, please come to the St. Louis County Department of Public Health, where we can connect you with a pediatrician and get you the care that you need. Remember, wash your hands, stay home if you're sick, and get your flu shot. It's not too late. So let's all do our part together in keeping St. Louis County and the region healthy. Thank you.
Thanks, Dr. Cunningham. Before we take questions, I do want to emphasize something that Dr. Cunningham said. The recent change in the CDC recommendations for vaccines is very unusual. The recommendations were made abruptly and without the usual public comment period, without the chance for community and scientific community input. We really want to encourage parents to talk to your family doctor and your pediatrician about what's right for your child. Talk to your doctor about your vaccines and ask questions. Ask them about the risks and the benefits. They know your child and they know what's best for your child. And I'd be glad to answer any questions.
What's the efficiency of the vaccine right now? Is it getting this strain?
Well, you know the efficiency statistics. The vaccines don't work for everyone, but we know that if you get a vaccine, we expect that if you get flu, and if you get the flu and you've had the vaccine, the severity of the illness will be less and the likelihood of complications are less. And that's much more important if you have chronic illness or if you're an older adult or if you're a child. It's certainly possible to get the flu if you've had the vaccine. It's much less likely if you do get the flu. It's highly likely that you will be less sick and less chance of having a serious life-threatening complication.
We know it, but let's go over what's the first signs people are going to see. What are the signs that they have this and they need to go to see it?
Signs and symptoms of the flu. You want to go over that?
I can do that one.
Yeah, that's your space.
Yes. So signs and symptoms. Individuals may experience significant tiredness or fatigue. Depending on which strain you have, you can also experience nausea, vomiting, of course, a fever, a cough. Those are all signs of the flu. I will say for some people, you may not be able to differentiate COVID-19 from the flu. Right now, this is the first year that there are at-home flu tests available. So I actually encourage people to stock up on COVID-19 tests as well as influenza tests. So therefore, you can test at home. And of course, you can always come here or go see your pediatrician. A lot of the signs and symptoms of respiratory illnesses kind of start the same: fever, chills, cough, myalgia, what we call that, fatigue. And then depending on if you have a different strain of flu, you can also have nausea, vomiting, and diarrhea associated with it.
And how are we doing as far as other counties go? Are we seeing a big number here, or is it just statewide?
No, it's actually across the nation. It's a lot in the public health sector as well as the physician realm. This is a big talk about how we're seeing increasing numbers of individuals being diagnosed with flu, as well as hospitalizations and even mortality is higher than it's been in the previous decades. One of the reasons why we're seeing this is that the virus actually mutated itself slightly over the summertime. So it's about 6 months to create the influenza vaccine. And as they were creating it, the virus itself kind of mutated. So you all may hear about subclade K. That is the new mutation. So that's one of the reasons why we believe we're seeing more diseases and seeing increased hospitalizations this year.
I got a shot in early fall. Is that going to cover this, or do I need to go now? How long is it going to last? When should I get it?
Right. So if you receive the vaccine early fall, we normally recommend September. Flu season is from September to March. So if you receive your flu vaccine for this season, you are protected. You're okay. You don't need to get a second one. But I do recommend annual flu shots for each new season. That's between September and March. The earlier you get it, the more likely you'll be protected. The budget cuts definitely have impacted the health department kind of throughout. Right now we're looking, it's not only just influenza, not only just, one area, specifically in the clinics, reduced our ability to purchase tests that we need for STI testing, TB testing, drugs, medications, even the purchase of some vaccines. So we're in a process right now of really taking a deep dive to really understand all of the budget cuts. But I would like to echo that I am concerned with the cuts because the public health depend on it. And so now we have to make a decision to make sure that we can ensure the safety and healthy well-being of our St. Louis County citizens.
Yeah, the budget cuts will impact the services we provide across St. Louis County and will certainly impact the services that are provided in the Department of Public Health. we'll continue to discuss with the county council if they want to continue a path towards reduction of services, or if they want to appropriate more funds to try and preserve the services that we provide to St. Louis County residents.
Do you plan on submitting supplemental budget requests for the health department?
Absolutely. We'll have a conversation about whether or not we will stay on this path of reduction of services. This is the wrong time in the history of our country to be reducing the commitment to public health. We see reductions in the federal government to healthcare services at historic levels. We're seeing reductions in the state of Missouri to healthcare, to the Medicaid budget at historic levels. And this is the wrong time to reduce the safety net in St. Louis County. Any other questions?
Are we at the point of suggesting people will be large groups going out?
No, we want our recommendations to prevent the spread of flu are straightforward, as we always have. Same recommendations. Flu cases are rising at record levels, at levels we haven't seen in a decade. The recommendations are to stay home if you're sick, wash your hands frequently, and get a vaccine, especially those who are older, especially kids, especially people with chronic disease. Please get your flu vaccine. It's not too late. You can get it at any St. Louis County Health Department. You can walk in. We're here in Berkeley today to emphasize how easy it is to come to the John C. Murphy Health Clinic in Berkeley and get your flu shot from St. Louis County.
Generally, a free shot.
It's, yeah.
Free or reduced. Yeah.
Free or reduced. Yep.
Sorry, Dr.
Go ahead.
Yes, free or reduced flu shots here. Yes.
Yeah. So all the services at the St. Louis County Department of Health are based on your ability to pay. It's supported by St. Louis County residents. We made that commitment, 70 years ago when we passed property tax that supports health care for uninsured and underinsured in St. Louis County.
So no excuses.
There's no excuse to get your flu. There's no excuse to not get your flu shot. Thank you. Let's do it.